Have you been told you're bone on bone and that you need a hip replacement or a knee replacement, or that there's nothing we can do about it? Well, my name is Dr. LeBauer from LeBauer Physical Therapy.
And I'm Dr. Herzog from LeBauer PT.
And we're here to tell you exactly what it means when someone tells you that you're bone on bone and what you need to do about it and why it doesn't mean you're destined for a hip replacement. So before we get into the video, please subscribe, hit the like button, and share this out with your friends, and check out our other videos on YouTube or Facebook or wherever you're finding this on our blog. So Dr. Herzog,
yes.
What does bone on bone really mean?
Bone on bone. So bone on bone, usually people find out when they just got an x-ray or MRI and their doctor's like, okay, you have bone on bone, it's terrible, and they just paint the worst picture in your head. But really all it means is that on each bone in your joint, there's a little bit of cartilage, and all it means is just that the amount of cartilage has decreased a little bit. So it might only be a little bit of decrease, it might be a lot, but usually people hear that they're bone on bone and they just get really scared, they get freaked out.
Why? Because what is that image of bone on bone? I mean, I don't even want to talk about it, but it's the image that we have in our head of what is bone on bone, like that's really bad.
Yeah.
But it's not as bad as it sounds.
It's actually normal.
Right, it's normal. It's normal as we age. If you're 30, 40, 50, 60, even 20, you might, if you have pain and you get an x-ray, someone might say you're bone on bone. The other thing is people always say, like, oh, you've got so much arthritis, I'm surprised you're still walking. I've had a patient tell me that. Or you've got so much arthritis, I'm surprised you can run, or there's no hope for you.
Yeah.
Well, we're here to tell you there is hope, and when you're bone on bone, it just means there's a little bit less space in the joint, but every 10 years of age, you get a little bit more of arthritis because it's really just wrinkles on the inside.
Wrinkles on the inside is what we like to say.
So like I got the wrinkles here. I'm 46 right now. I got the wrinkles here. Dr. Herzog's a decade younger than me, at least.
I hope I don't know myself yet.
Maybe two. But we have wrinkles outside, and the reason, I think if you might see me laughing because it might be very serious for you, is that we hear this all the time, and it's especially it's the worst I've ever seen. It's bone on bone. It's the worst I've ever seen. Well, I've seen patients for the last 20 years, probably dozens of patients a year, who I was told I'm bone on bone. It's the worst they've ever seen. Well, I've actually never seen one. I mean, they're actually not that bad. Yeah. Because when we step back, what does pain really mean, right? You're probably having pain in your knees beforehand, and you went and got an x-ray. Can you tell us how those two things match up?
They don't necessarily always match up. That's the thing, is there could be a lot of different reasons for your pain, and all an x-ray does is look at your bone in your joint, but it ignores all your soft tissue, all your muscle. They also just take a picture of you when you're still, not when you're moving. And most people that walk into our clinic have pain only when they move. It's not like, oh, I have pain when I'm sitting down just chilling. So usually it's more of a soft tissue, muscle, or movement problem, not a bone problem.
Right. Because, for instance, we'll have people come in and they're like, I was bone on bone, and my knee hurts, and I'll touch and I'll press, and what I'm really pressing on is where the quadricep muscle, where the thigh muscle crosses the knee. I'll press on that. Is that where it hurts? Yes, that's exactly where it hurts. Okay, well that's nowhere close to where the joint is and what's happening inside the joint. Because a little arthritis doesn't change what happens in your joint. I've worked with people who have so much arthritis where shoulder, where it doesn't move at all, but she had no pain at all. I've had a patient come in who was told he needed knee surgery. We worked on his knee, loosened it up, created more space in the joint, and he was back to running and playing basketball within about 2 months. Yeah. When he was told he needs knee surgery and should no longer run.
Jeez.
Yeah, and then he just came in a couple times, once or twice a year over the next few years, just to get it loosened up a little bit when his self-care routine would change or more stress, and we'd work on a couple other things. I haven't seen him in years. And I had another patient, just so you know, it's not one person, I had another patient told he needs both knee surgery. Yeah. And I was like, well, what do you want to be doing? He's like, I usually walk 5 miles a day briskly, and I need it to reduce stress. Well, even though his knees didn't look perfect on the x-ray or in person, we got it to where he didn't have pain that kept him from walking 5 miles. And he was able to do everything he wanted, run, squat, and play, even though he was told he was bone on bone and needed a knee surgery. So one of the main messages, if you hear that, what that really means is that you don't have cancer. Yeah. Right?
It's good news.
It's good news.
Yeah.
It's good. If someone says, oh, you're bone on bone, at least you don't have a tumor at the end of the bone or in the cartilage that's going to be a real big problem. Because if you have a tumor in the bone in your leg, it's usually a sign that you've got tumor somewhere else. It probably goes along with other things. So it's good news. When you get an MRI or X-ray, just know that the things you're looking for are fractures, tumors, and like a spinal cord compression. But even a spinal cord compression and a tumor will show things on the outside that don't seem congruent. It's like if it smells like a duck and it walks like a duck, but it looks like an egg, something's fishy, right? We know that. The X-ray or MRI just confirms it. But if you have pain, it's not going to show you the soft tissue problem. And a lot of times, where does knee pain come from?
Usually a joint above or below, so usually your hip or your ankle not moving well.
Right. And if you've been told you're bone on bone, but no one's looked at your hips, ankle, or even back, then you need to have someone look at those areas, because the pain you're experiencing in your knee may be coming from, I'm going to stand up, there's muscles up here in your hip, they come all the way down and cross your knee. So from here to here, and it can be a hip problem, referring pain down here. It could be how your ankle moves or how your hip moves.
Yeah, because we've had people who have been told that they have bone on bone, they get the joint replacement, and it doesn't work. And turns out, same thing, they were looking at the wrong joint. They had a hip problem, not a knee problem. So we worked on the hip, and they got back to playing soccer just fine.
Right. And if you're watching this and you've already had a hip or knee replacement, great, and it's not a bad decision, because if you needed it, you did, but there may still be reasons or things going on there. You have like a hip problem or an ankle problem, and we can make you stronger. I've seen people come in after hip replacement surgery, they feel better, but they're not back to their activity level. And what we specialize in is helping people get back to their high level of activity. There are people that have raced professional bikes. There are people that have run marathons after. I worked with a patient who ran probably 3 or 4 marathons after her hip replacement and after knee replacements. You can play basketball and you can run and you can squat and you can probably power lift.
Oh yeah, because
powerlifters that
there's this guy in Winston who he had a double knee replacement and he front squatted 300 pounds after it.
Wow.
Yeah.
Wow.
It's crazy.
Yeah. So pain really means that there's a problem. It doesn't always tell you where it is. And if you have pain in your knees and someone's told you you're bone on bone, or it's the worst you've ever seen, or you're concerned that the arthritis is going to get worse and not better, and you'd like us to take a look at you, and what we offer here is called a total body diagnostic, where we don't just look at where the problem is, we look above and below and your whole body. It's a free visit. It takes about 20-25 minutes, and at the end of that time, we'll know exactly where the problem is, and you'll know exactly what to do about it and how we can help. So if that's something that sounds interesting to you, there's no obligation, no cost to it. All you have to do is contact us or call us. There's a link below or above the video, but probably below, and where you can apply to come in for a free total body diagnostic, where we'll tell you exactly what's wrong and how we can help you fix it. Even if you're bone on bone, I'm pretty sure that we can help, especially if everyone said, oh, you need surgery. Is surgery the real thing that you need? Not always. Sometimes it is, but we'll even let you know if we think you do. So make sure that if you got something out of this, you hit like and subscribe. Comment below. If you have a question below, great. We can sometimes answer them, but let us know what you learned below. Please share this with your friends or anyone else you think might need it, and we'll see you on the next video.